Hello everyone. My paper's title is The Effects of a Comprehensive Exercise Program on Physical Activity. Let's start my presentation. First is the introduction. The ability to maintain balance is the crucial for humans to perform purposeful activity of their living, and it refers to the process of the continuously maintaining postural stability. For an appreciated balance reaction to occur, proper mechanism of support of the musculoskeletal system and motor functions through the coordinations and integration of sensory functions are required. It is difficult for elderly people to maintain body balance due to musculoskeletal dysfunction and decline in sensory function and postural instability, and a decrease in balance and functional mobility is a major cause of the decreased gait ability and force. Among the factors that reduce balance ability in elderly, a decrease in muscle strength and range of motion induce loss of function, independence, and increase in the risk of falls. To prevent these problems, systemic and regular exercise are required. It is known that more significant changes occur in the lower limb muscle than the upper limb muscles. In particular, the quadriceps and soleus muscles has been reported to show a greater decrease in volume with aging compared to other muscles in the lower limbs. To this end, exercises related to increasing balance ability through strengthening of lower limbs and pelvic muscle were also included in this study to enhance the balance ability of the lower limbs and the pelvis. The results of a prevent study show a significantly increase in balance ability after application of a program compared to before application of the program, regardless of gender. The aging of the world's population is a critical change that most countries are facing. This global aging phenomenon is caused by prolonged life expectancy for a variety of reasons, such as delayed death in people with chronic disease and expansion of social capital due to overall economic growth and education and easily accessible medical system. As humans get older, they often suffer from physical and mental abnormalities and experience problems such as economic poverty due to reduced income and a decrease in their role in the family and society. Elderly people may experience reduced sensation and mobility and integration, the first of which is the manifested as a decrease in the functions of sight, vestibular organs, and proprioceptive sensation. Lower mobility is manifested as a decrease in the muscle strength, coordinations, and endurance, while reduced integration is manifested as a decrease in reaction time and multitasking capacity. As various aging-related problems emergence, increased attention is being paid to elderly health issues, and interest in quality of life in older age in the particular is emphasized rather than simply extension lifespan. The quality of life in old age encompasses all aspects of life, including social condition and personal perception of life, as well as physical and mental and economic conditions. Aging refers to the progression from young adults who are mostly healthy and require little health care to older adults who undergo psychological deterioration that gradually increase the risk of disease and death. In the normal aging process, the body composition of muscle and bone and fat changes, and these changes are highly responsible for the increase in the incidence of disease and the decrease in nutrient and metabolic action in elderly people. Aging results from a combination of reducing physical activity, lower immune function, decrease in endurance, regulatory function, and sarcopenia are conditions of decreased skeletal muscle and muscle strength, which is observed in the most aging process. In sarcopenia, the decrease in muscle strength has a more important meaning than the decrease in the muscle mass. Sarcopenia mainly refers to a decrease in muscle strength in the limbs due to the decrease in the skeletal muscle distributed in the limbs. Thus, sarcopenia doesn't mean a decrease in muscle mass with aging. Rather, it means a decrease in muscle function, including muscle strength and performance. Skeletal muscle account for about 40 from 40 to 50% of a person's total body mass, and decrease by from 3 to 10% every 10 years after age 25 years old, during which mitochondrial functions also decrease. Weakening of skeletal muscle causes muscular system disorders and is a prominent symptom among people with neurological disorder. Three change in muscle strength due to the weakening of muscle is a sensitive indicator for the aging process. Muscle weakness in elderly people is directly related to the movement of the upper limbs and the mobility of the lower limbs for them to live an independent life. Third, maintaining a status without muscle defects is important for preventing and delaying the physical weakening process. To maintain posture and perform voluntary movement in daily life, posture stability and balance ability are required for the body to respond properly to external change. Please provide us several studies on this area has reported that the most common cause of injury in elderly people are their decreased ability to control balance and impaired function mobility. Fall is a common problem in the elderly and one of the major causes of increased morbidity and mortality. Falling accidents can occur throughout all life cycle, with a higher incidence, especially in the elderly over the age of 65 years old. Most elderly people experience a decline in balance ability, which causes falls. The risk of falling is 10 times higher in the elderly than in other age group, and 30% of elderly over the age of 65 years old experience falling accidents at least once a year. While interaction among the motor system balance ability detects stimuli caused by the external environment and recognize change in the body orientation and maintains the center of gravity. The maintenance of the balance is associated with the stabilization and contraction of counter of upper and lower limb muscle through the interaction between vision and cerebellar function and vestibular sensation and the proprioceptive sensory system. To maintain balance and normal motor skill and sensory skill and cognitive skill of the brain, which play on the upper level central role, are required. As aging progresses, elderly people experience a decrease in their balance ability and muscle strength, which results in gait impairment. This aging process further leads to a decrease in gait instability and balance ability, and limiting the social uh, out, uh, social autonomy of elderly people, and in some causing for the the sense of balance and gait ability are important factors that have a greatest impact on mobility. As the sense of balance decreases, the walking velocity decreases, and the stride lengths become narrow. Elderly people also suffer from flexion contracture of hip joint and weakening of the plantar muscle of ankle joint, which leads to a decrease in walking velocity and stride length, as well as an increase in cadence and duration of stance pacing. For elderly people who are experiencing such aging processes, certain physical activity problems to help them enhance their muscle strength and balance, and programs that are appropriately applied with the sufficient intensity have a positive effect on the muscle strength, balance, and cardiovascular health of elderly people. A study that investigated the effect of exercise in the elderly showed that regular physical activity and exercise are important for healthy aging and can help elderly people manage chronic disease. It has been recommended that a minimum of 150 minutes of moderated aerobic activity or 75 minutes of intense aerobic activity for the elderly is necessary in consideration of the individual's health status and functional ability. The elderly, the elderly can benefit from the aerobic exercise, muscle strength or resistance training, flexibility or stretching exercise, and balance training. A review examining the effect of aerobic exercise on the elderly reported that an aerobic exercise program had a beneficial effect on the blood pressure and lipid and glucose tolerance and bone density and depression and quality of life of elderly people, and that the maximum oxygen consumption was significantly improved in all conditions. As the elderly population increased due to advance in medicine, many studies are being conducted on elderly people. Most previous studies focus on the improvement of muscle strength and balance after engaging in only fragmentary exercise program. Study examining the effect of comprehensive exercise program are insufficient. Therefore, this study designed a new group exercise program that includes several individual exercise programs aimed at increasing muscle strength and balance and flexibility and gait function. The effect of the program of the muscle and the balance and gait and quality of life and correlated efficacy of elderly people, as well as potential gender-related effects were investigated. And next is the method. This study was conducted on 36 elderly people who participated in the elderly health class at welfare center through the public recruitment and registration and local public health centers. In the course of this study, 5 people dropped out due to the non-participation in the program, difficulties in performing exercise, and personal circumstances, leaving a total 31 participants in the study. Prior to the starting, the purpose and method of the study were sufficiently explained to all subjects, and the study was conducted after they provided voluntary consent to participate. The inclusion criteria for selecting subjects were as follows. First is those who did not have a major problem with their daily activities. Next, those who score 24 points or higher on the Korean Mini Mental State Exam. Those who has not regularly participated in other exercise program at least 3 times a week for last 6 months. Next is those who has no difficulty working due to orthopedic disease. Fifth is those who has not exercised regularly within the last 3 months. Next, those who could participated the program for 2 days or weeks. Next, those who could communicate with others, and lastly, those who consented to participate in this study. Comprehensive exercise program is now explains now. The comprehensive exercise program was performed twice a week for 20 weeks, and muscle strength, balance, gait, quality of life, and correlated efficacy were evaluated before and after the exercise program. The program consists of 3 stages, including the first and 4th weeks program, and the 5th and 8th weeks program, and the 9th and 11th 20 weeks program according to the level of difficulty. Before performing the comprehensive exercise program, a warm-up exercise such as right stretching was performed for 10 minutes, followed by a 40 minutes comprehensive exercise program. The finishing exercise was performed for 10 minutes after the main exercise program was completed. The comprehensive exercise program and all tests were carried out and evaluated by two physical therapists who has more than 5 years of clinical experience. Unlike the conventional single-test exercise, the comprehensive exercise program was designed with the aim of improving the elderly's balance and working ability, as well as enhancing their muscular strength and endurance. The exercise was applied by using elastic bands and balance pads that were easy to apply to elderly people without using complex equipment, and by providing various resistance to upper and lower limb using their body weight. As such, the comprehensive exercise program consists of exercise using the body as a resistance, and exercise using a resistance band, and exercise using a balance pad. In the first week's program, after receiving general training on the exercise method, the subjects performed exercise 1. In the 5th and 8th week program, exercise 2 and exercise 3 program were performed. And during the from 9th to 20th weeks or higher intensity exercise program that simultaneously apply a band and a balance pad was performed. At the first weeks of the respective weekly programs, training of the posture for the exercise method was mainly conducted, and the exercise intensity was increased by mobility, the number of exercise, and the exercise speed in the following week. Muscle strength is to measure the muscle strength of elderly subjects. Their grip strength was measured. The grip strength was measured using a digital grip diameter. Before measuring grip strength, the grip diameter and the measurement procedure were explained to the subject to help them understand the procedure. After removing the accessories, the subject performed a right warm-up exercise by shaking body hands 3 times, and then gently gripping and unfolding all their fingers 3 times. Bug balance scale is a tool that objectively measures static and dynamic balance and was created by Burgess. The BBS assessment tool consists of 14 functional tasks that are generally performed in daily life, in which a minimum of 0 to a maximum of 4 points are assigned to 3 areas: sitting, standing, and postural change for a total of 56 points. This is a functional balance test that consists of 3 aspects: postural maintenance, voluntary postural control, and response to external function. It is used to evaluate the balance ability of elderly people and nervous system patients at high risk of falling. Times up and go test. The subject sit on the chair with the armrest, then with a command of start. Get up from the chair, walk straight up to the mark 3 meters away and return to sit back on the chair. This process was repeated 3 times and the average times was measured. Through the TUG test, balance mobility and balance can be measured quickly, and it is a tool with a high reliability. In the TUG test, if the test takes more than 30 seconds, it indicates that the balance mobility of subject is dependent and that independent activity are difficult. Taking longer than 14 seconds to perform the activity indicates a high risk of falling and an aid such as cane is required for walking. Quality of life assessment has related to quality of life evaluation. SIT was used to assess quality of life. The SF-36 consists of 36 questions, each measuring 8 health concepts and includes one multiple question area. The 8 health concepts include general health, physical function, physical role limitation, emotional role limitation, social function, pain, vitality, and mental health. The result value was obtained by summing of score the questions from the 8 times that are evaluated health level. Korean Falling Efficacy Scale measures the level of confidence associated with the fall prevention, in which the level of fear associated with the performing 10 necessary actions in daily life is expressed as a number function 1 to 10. 1 point is assigned if there is no fear, and 10 points if the subject avoided the action because they are very afraid. The KFES score in this study ranged from 10 points to 100 points, where the lower the score, the higher the fall-related efficacy. Next is the result. In this study, the average group strength increases significantly from 21 and 21,26 kg before application of the program to 23,48 kg after application of the program. And a significant increase was finding in the balance ability from 42,28 points to 46,84 points on average. In the gait evaluation, the average working time significantly decreased from 10 seconds to 8 seconds due to the increased working velocity. In the evaluation of quality of life, the average score significantly increased, and the evaluation of falling-related efficacy, the average score significantly decreased. Regarding gender, men show statistically significant change in grip strength and quality of life compared to women. But there was no significant difference in balance gait and fall-related efficacy between males and females. Last is discussion. A previous study that examined the effect of a 60-minute exercise for 10 weeks on balance and muscle strength in 75 elderly people aged 65, 85 found that the balance of muscle strength were improved in all exercise programs regardless of stability of base of surface. In another study that investigated the effect of a high-intensity function exercise program on the balance and daily life movements of patients with dementia, the group that engaged in the functional exercise program showed decreased dependence and increased balance in elderly people with non-Alzheimer's dementia compared to the groups that engaged in only a lower limb strengthening exercise or a lower limb balance exercise, which is consistent with the finding of the present study. In summary, we investigated the effect of a comprehensive exercise program designed by providing resistance to body, used a resistance band and instability to a base surface with a balance pad on the physical activity and psychological factor of elderly people over 65 years. This 20 weeks comprehensive exercise program was compounded in three stages of 4 weeks with each. The results of this study showed that there was significantly difference in muscle strength and balance and gait and quality of life and correlated efficacy after the exercise program was completely compared to before application of program. A remarkable improvement in muscle strength and quality of life was observed in males compared to females. Applying various types of resistance and texts simultaneously for systematically accumulate a comprehensive exercise program positions this program which is the potential to enhance the ability of elderly people required for their physical activity as well as manage their psychological factor. Nevertheless, this study has a limitation in that the sample size was small, the study period was short at just 20 weeks. The evaluation was conducted only before and after evaluation, and there was a lack of use of quantitative evaluation method. For the study, should consider investigating the benefit of this comprehensive program in age subgroups of elderly people aging 65 or older for longer than 20 months.